For group 3, we chose the knee, and this is the common name. The anatomical name is called the tibiofemoral joint, and this contains two articulations, the first one being the patellofemoral, and this increases the efficiency of muscle, and the tibiofemoral part is the weight-bearing component of the knee joint. There are two classifications within the knee joint, the first being structural, which is a Savinial hinge. So the joint moves like a door on a hinge. And functional classification, which is diatherosis. Within the tibiofemoral joint, there are 4 different kinds of movement. The first one being knee flexion, and this allows the knee to bend. There is knee extension, which allows the leg to stick straight out, and knee internal rotation means that your toes are facing inward and heel outward. Knee external rotation means that the toes are facing outward and the heel is facing inward. So there are 4 kinds of muscles that relate to the extension of the knee, the first one being the rectus femoris. The origin of this comes from the anterior inferior iliac spine, and the insertion is the tibial tuberosity. And then there is the vastus intermedius, and the origin of that is the proximal anterior femur. The insertion is the tibial tuberosity. And then there is the vastus medialis, and the origin of that is the proximal medial femur, and the insertion of that one is the tibial tuberosity. And the last one is the vastus lateralis, and the origin of that one is the proximal lateral femur, and the insertion is the tibial tuberosity. For flexion and internal rotation, there is the semitendinous muscle, and the origin of that is the ischium of the pelvis, and the insertion is the proximal medial tibia. And then there is the semimembranous muscle, and the origin of that is the ischium of the pelvis, and the insertion is the proximal medial tibia. And then for flexion and external rotation, there's the biceps femoris muscle, and the origin of that is the ischium of the pelvis, and the insertion is the proximal lateral fibula. For the knee joint, there are different nerves that correlate to the movement of these different muscles. For the femoral nerve that roots at L2, L3, and L4, the rectus femoris, vastus intermedius, vastus medialis, and vastus lateralis, those all correlate to the femoral nerve. For the tibial nerve and the common peroneal nerve that roots at S1, S2, and S3, and as well as L5, those correlate with the biceps femoris muscle. And for the semitendinous and semimembranous muscles, there is the tibial nerve that roots at L5, S1, and S2.